Howard Catton. He is the CEO of the International Council of Nurses. He joins us live from Geneva. Thanks so much for being with us, Howard. 10% of total infections are among nurses, from what your report has said. I mean, that is an alarming statistic in itself.
It is. Good evening. The very grim milestone of more than 1,000 nurses who we know have died. That's from 44 countries, so I'm very sad to say that the true number will be even higher. Of all coronavirus infections, we think about 10% are healthcare workers. You're right, that then would be a huge number. It could be up to 3 million healthcare workers who have been affected. So the clapping has stopped, but nurses, healthcare workers remain absolutely in the eye of this pandemic. And frankly, we are seeing far too many governments still being slow or failing to act to prioritise and protect health workers. They're still not all collecting the data. There are still problems with PPE in care homes. There are examples still of nurses being subject to violence and abuse. There can be problems with testing and with training as well.
I want you to expand on that, though. Where and how are you seeing these nurses subjected to that and not being protected as they should?
Our survey showed that 70% of our national nursing associations from right around the world reported acts of violence or discrimination. Just to give you some examples, from South America and Mexico, bleach being thrown at a nurse. From somewhere close to home in Europe, from Ireland, where nurses were finding it difficult to get childcare because the childcare provider was worried that the child might spread the infection. Some of these acts are reprehensible, and we're saying to governments, you must take a zero tolerance approach. But what many governments are also not doing is to recognise coronavirus as an occupational disease. And that is really important, because when you recognise it as an occupational disease, you report it, you collect data, you do real risk assessments, you set standards, and importantly, you'll offer compensation to nurses who may become unwell, have to retire, or if they die. And let's not forget, we have had reports of nurses who sadly have died, but who leave children and families, and they need compensation, they need support to survive.
Right, and that is another thing. I mean, these are heartbreaking scenarios you're describing here. And another thing you point out in this report is that these nurses are left not just fearing for their own lives, they're fearing for others, including their families, whom they are scared they can potentially infect. And that takes a huge psychological toll on our healthcare workers.
I am really worried about the psychological, the mental health pressures and burdens that nurses are under. It's highlighted very, very clearly in the report. My worry is that it could be a hidden part of the pandemic which we haven't fully seen as yet. Yes, nurses are worried about their own safety. If you can't get personal protective equipment, or you're worried that it's faulty, or you haven't had the training, that in itself adds pressure and a burden on you. You're worried about your family as well. You're worried about what would happen if you become sick and unwell. So we are saying that we need much, much more attention on psychological, on mental health support. I fear that in the worst case scenario, there may be some nurses who would suffer post-traumatic stress disorder. We're 6 million nurses short worldwide. The last thing we can afford to do is to lose those staff that we currently have.
Right. Howard, we're going to have to leave it there. Really, we wish you the best of luck going forward with your efforts here. It is so, so important. Thanks for joining us there from Geneva.